Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
All right, well, we're really happy about it. But today, Brad, we're going to talk about can you return to running/walking after low back pain or sciatica? This is basically not a yes or no question, is it?
Right. There's so many different degrees of how severe it was or how things have healed or what your history is or, So we're going to talk about this. And Bob and I are going to go back and forth. And if you listen closely, I think we're going to find out what's going to fit your particular needs.
Right. It's going to be so individualized that you're going to have to adjust it to how your pain is reacting when you do stuff. So.
And that's all part of therapy. When a patient comes in to us, we're customizing exercises to fit our patients all the time. We just don't go into the book and say, oh, back pain with running,
right.
These are the 10 that you're going to use.
There's no cookie cutter. It's always an adjustment.
Exactly.
So by the way, if you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Subscription button here or here.
Wow.
And by the way, Brad.
By the way.
Please get some people to like us.
Yeah.
We will like us on Facebook.
We want to be liked. And
the reason you'll want to do that, by the way, we give you a reason, is that we do give away a lot of free stuff. And right now we are giving away, we're going to have a contest. Next week we're going to give away 3 of these. The Napo memory foam, I got a picture of it up. You should be seeing it right now.
Oh, good.
Lumbar support, pillow/cushion. It's for low back pain. Relief for home, office, and car use.
Right.
Napo.
I'm kind of excited about using this one in my car because, as you know, if you watch our channel, my back is a constant thing I need to deal with. So with spondylolisthesis. So yeah, I can't wait to use this.
Yeah, we'll give it a shot.
All right.
All right. Brad, what do you want to start talking about? The spine?
Well, Bob, back to the show. I want to talk about the spine. Here we go. We got a spine right here, and we're talking about the low spine. And what I wanted to do, we're talking about running, which is considered a high impact activity. So let's go into what do they mean by high impact?
Sure.
You think about impact, you think about taking a hammer and hitting it on a table. Well, we're not really talking about that kind of impact, but in a sense we are. So we're going to look at the spine. Maybe should I go up there?
Walk on up there. Yeah.
Let's pull the pointer pin. We have the official pointer pin here. And if we look, let's say, for example, this red disc represents the source of your back pain. It may be herniated. You may have some problem in the facet joints, but that's the area. Yep. What's going on with that disc when we walk and when we run, and what kind of stresses are being put on it?
These bones are coming together, and they're putting additional stress on the disc.
Right. So if you're talking about walking, it's not considered a high impact activity. You have heel strike, and you have more forces going through your joints in your back as your heel strike goes through, but it's not terrific as compared to when you jog or run. And if you're a heel striker and you land right on that heel, that puts
those forces are going all the way up through the leg into the back.
Exactly. Plus you're only on one leg, so you got a force that's going through your pelvis all on one side, which can kind of put it at an angle and cause some other problems, particularly if your core is not strong yet.
Can I just say as a rule of thumb, Brad?
You can.
Basically, with a lot of our back patients, we try to get them walking like from day one.
Sure. Yeah.
And it's going by their symptoms. If it makes their symptoms worse, we're going to have you stop.
Right.
But if you can walk 20 minutes, do it. Obviously don't go out 10 minutes and then find out you can't make it back.
Right.
You're going to be stuck out there.
Exactly.
But the other thing with sciatica, it often helps to take shorter strides.
Sure.
So you're putting less stress on the nerve.
Less heel impact.
Right.
Exactly.
So short strides, definitely want to try to get to walking as soon as possible.
Okay. Now let's look at that disc in this high impact when we start to jogging or running, because that's what I have a lot of people commenting. Can I get back to running after I have sciatica? This green ball has got gel in it, and it's got a tough outside layer just like a disc. I'm going to put it in there, and that represents a disc. Can you zoom right in on that, Lonnie? All right. So normally there's a little shock absorption like this, and that's one of the jobs of the disc, is to take a little shock away. And you've got 5 discs in your lumbar spine, but every time your heel strikes, it's going to boom, it's going to pound in there. And then if you look back here, if your disc is not fully healed, every time it pops, it could eventually lead to that again, that herniated disc, because we got that impact. And it's not just 1 or 2 times, but if you're going to run a mile, you're going to have hundreds of those little impacts occurring.
Right, and the other thing is posture is still so important with walking and running. I see runners that do not have good posture running.
Sure.
I mean, they're flexed, and that's going to put that disc more likely to scoot out the back.
Right. With
You know,
poor posture, that bulge is more likely to reoccur.
Right.
You know, because most bulges do come out the back. It's possible that it's one that doesn't. But we're talking about the majority
So with
here.
walking and with running, you really want to work on really good posture.
Exactly.
Keeping that spine as straight as possible.
Okay, so this is what this is how I'm gonna suggest if you've been a week. This is a pretty conservative approach, but it's
Sure.
gonna be a safe approach, and it's gonna give you your best odds for having minimal chance of reoccurrence. So be patient with this. No symptoms down your leg or in your back for a week. You're feeling pretty good.
Can we talk about what you should do before you even walk, Brad? Maybe do a couple of the back exercises.
Sure, right.
So, do you want me to show?
Yep, go ahead and show. Now, Bob's going to show a common exercises that works good for a herniated disc or sciatica.
So you're putting your hands underneath your shoulders, you're keeping your pelvis down, and you're pressing up like this.
Right.
And yeah, now again, this will often work for a lot of different types of back pain too. Just
Sure.
normal.
Yep.
80% of the people that have back pain, this is going to work for.
Sure.
It's not going to work for you, Brad, because you have spondy.
Right.
And it's not going to work for spinal stenosis, but
Right.
it's going to work for a lot of people. And you can do just 2 half press ups here, but these are good to do right before you do the walking or running.
Right.
And you can also, you want to just show a standing one, Brad?
Sure. Why don't you do it, Bob? I don't like
Okay.
doing them.
Again, you can go ahead. The only reason Lonnie doesn't like me standing up tall.
We're looking at his back end.
So anyway, you're going to grab, you can put some pressure on the belt line here, or you can put hands like that, and you're just going to bend back and do a couple press ups, press backs, I guess you'd call it, huh?
Yep. I just call them back bends.
Back bends.
Yep.
Prior to doing the exercise.
Now, if you got some modified exercises like this that you know work for you, stick with the ones that you know you've had good success with. So after you've had no problems for a week, you're doing your exercises, you started walking, walking's not a problem, you're walking up to a half mile, perhaps a mile, without any problems.
Sure.
Then you can start jogging. We're not going to go into running. We're going to go into jogging, and I'm going to suggest you do a walk-run protocol where you're going to run or jog, for 400 meters. If you don't know how far 400 meters in is, like a block.
Right.
Okay. You're going to, block would be less than that, but if you're a runner, you know what 400 meters
It's
is.
once around the track.
Yep, exactly.
Outdoor track.
Then you're going to walk. Okay, you can walk before you start the run, and then you're going to walk after you run. And I'm going to say do that for 3 days, and if you have no symptoms, this is a little conservative, but it's going to be safe, then you can bump up to 800 meters.
And with both of these, I would really keep a short stride.
Sure.
A lot more foot strikes rather than trying to stride out.
Yep.
Because you're going to put less stress on the sciatic nerve that way. So.
Exactly. Just remember the model we had with the disc earlier. Just think about every time you hit. So you're going to try and run smoothly, and I have a friend, I can hear him run right next to me because he goes clap, 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 clap.
Brad and I both had a discussion about this. Well, we had both changed our running style to be more forefoot runners,
Right.
As opposed to heel strike runners.
Right.
And it really has lessened, I think, our injury risk.
Oh, sure. And that's another video, but
Right.
That's an option you can look into. So after you're running 800 meters or a half mile, and then you're going to walk, and after you do that, walk, run your 800 meters, walk again, do that 3 days in a row, and if there's no symptoms, things are feeling good, and you're itching right now to get back to your running, I'm going to say put the brakes on. Then I want you to go to a protocol of walking your 5 minutes or so, running 800 meters, walking, run another 800 meters, walking, run a third 800 meters. So you got 3 sets of walk and 800 meters, and then do that for 3 days. And if that is clear, then I want you to jump into running the distance of, up to 1,600 meters or that mile distance. And always doing the jogging. And not until you get to that mile distance and you have 0 symptoms for a week, then you can start going into your higher speeds and longer distances.
And in all cases, by the way, Brad, what you want to allude to is that when you get done running, you want to avoid doing stuff like this.
These are things you don't even think about.
Yeah, you're trying to get yourself, some accessory muscles here over your chest that help your breathing, but this is really not good for your back. If you want anything, you want to do a few of these.
Right. So Bob's talking about when you get done running, you're tired. This just becomes a habit, especially if you're, when you're healthy, you're sprinting, if you're doing some high impact or high intensity workout, this is just a normal resting, or you sit down in a chair.
And you slouch.
And then you slouch while you
because
catch
you're
your
tired.
breath. Yeah.
And And Mackenzie, by the way, the ones that we think is probably one of the greatest developer of exercises for the
Spine.
sciatica, he said one of the things that he thinks causes pain more than the exercise themselves is how people act after the exercise. They sit and they slouch because they're tired.
Because they're fatigued and the body
The
goes...
body's really warmed up, so
Right.
it really bends.
Exactly.
So it's not a good thing for it.
And then the other thing, just like we had mentioned here, you get your workout in or whatever, no matter where you're at, look at your seated posture. I think this gets forgotten about a lot. Your running might feel good and everything's, the running or the walking's helping it perhaps, but
Right.
then you go in your car and you sit and drive for 2 or 3 hours.
Right.
And if your car does not have a good lumbar support, and then you get out of your car and it's hard to get out and it's hard to straighten up, you need to change your
Yeah,
seated
it
posture.
wasn't the running that was a problem or the walking that was a problem. It was what you did after.
Right,
So always
right.
make sure you keep aware of that.
So good seated posture, good body mechanics, and build things up and get that back strong again. We didn't get into core exercises on this too, but that would be another
Yeah.
benefit to keep that core strong around your abdomen and stomach back.
And remember, Brad, we can fix just about anything
Exactly,
except for a
Bob.
broken heart.
You say that now, but what do you really mean?
But we're working on it. That's what I mean.
I've always wanted to say that.
You always want to say a lot of things.